What is a late-term abortion? Here's what politicians mean, and why it's not medically accurate. The inflammatory phrase seeks to politicize a situation that can cause unimaginable suffering for pregnant people. By Susan Rinkunas, October 27, 2020. Opponents of abortion have long tried to stigmatize the medical procedure, but in the past few years, they've targeted abortions performed in the second and third trimester. President Donald Trump and Vice President Mike Pence have repeatedly claimed that Democratic lawmakers support late-term abortions done up to the moment of birth. Doctors, meanwhile, have repeatedly explained that they do not perform abortions while people are in labor or in the days before their due date, but the talking point persists. My patients didn't ask to be spoken about this way. They didn't ask for their health care to be politicized, and they're the ones that are suffering the most from all of this. Jen Villavicencio, MD, MPP, an OB-GYN, an abortion provider in Michigan, and the Darney Landy Fellow of the American College of Obstetricians and Gynecologists, tells Health. Inflammatory language like a late-term abortion is used to deflect the conversation away from the safe, legal provision of compassionate medical care to patients, Dr. Villavicencio says. Here, OB-GYNs and abortion providers cut through the political talking points and focus on the facts regarding abortions later in pregnancy. This is what you need to know. What do politicians mean when they say a late-term abortion? In short, it's a sensationalized phrase that doesn't reflect science or medicine. While people may have heard physicians use late term in a medical setting, it refers to women in the 41st week of their pregnancy, that is, women who are still pregnant after their due date. And no abortions occur during this time period, Dr. Villavicencio says. Physicians instead say abortions later in pregnancy, or later abortions, or simply refer to the trimester when the procedure happens. What is a later abortion, and how often does it happen? It depends on who you ask, but generally later abortions are those that happen after a specific point in pregnancy, for example, beyond 20 weeks or in the third trimester, or after a fetus is viable, which is thought to be at about 24 weeks, though that's not a hard and fast rule. There is no magic switch that flips in the same week of every pregnancy after which that fetus is viable. Viability is determined by a physician on an individual basis. Abortions in the second trimester are most often done via a procedure known as dilation and evacuation, or D&E, where the cervix is dilated either with medication or seaweed sticks known as laminaria that swell and open the cervix, and then the pregnancy is removed through the cervix using instruments. Abortions in the third trimester, which are a very small number of procedures, involve inducing labor. Daniel Grossman, MD, an OB-GYN, an abortion provider and a professor of obstetrics at the University of California, San Francisco, and director of Advancing New Standards in Reproductive Health, ANSIRH, tells Health. These later abortions are rare. According to the Centers for Disease Control and Prevention, in 2016, just 1.2% of abortions were performed at 21 weeks of pregnancy or later. Another 7.7% were done from 14 to 20 weeks, while the vast majority, 91%, were performed at or before 13 weeks. Put another way, this means 98.7% of all abortions happen before 21 weeks. Dr. Grossman says there isn't great data on the breakdown of procedures after 21 weeks, but he says it's clearly much less than 1% past 24 weeks. Given that these later procedures are so uncommon, Villavicencio says the political focus on abortion later in pregnancy does not reflect the medical reality and disproportionately impacts those who find themselves in need of critical health care.